I want to bring in Dr. Nahid Bhadelia. She is the director of the Special Pathogens Unit at Boston Medical Center and an MSNBC medical contributor. I also have Dr. Andre Campbell with us. He's the attending trauma surgeon at Zuckerberg San Francisco General Hospital and Trauma Center. Thanks to both of you for being here. Dr. Campbell, I want to start with you because what we are hearing, particularly about California, mostly Southern California, but the degree to which hospitals are filling up, ICU beds are filling up. And in fact, in the San Francisco and Bay Area in particular, we know that that is a serious issue.
Well, good morning, Ali. Thank you for having me on again. The first thing is that we're in critical condition, literally in the ICU. In Southern California, we have 0% capacity. In the Bay Area, we have about 12% capacity for ICU beds. So this is a serious problem. Now, we had a bump after Thanksgiving, and California is literally on fire. We have 2 million cases, somewhere thereabouts. We have 23,000 deaths, right? So what that means for ICU capacity means not only the physical beds, it means nurses, it means doctors, it means respiratory therapists, it means the people who clean the room. These are the things that we need to do that. And we're worried because now more people are traveling. And in fact, we may have a bump on a surge, or a surge on a surge on a surge. I mean, a couple of days ago, 3,000 people died in one day. One day. I mean, that's equivalent of 5 or 6 wide-body planes crashing one day. This is an emergency, so we're very concerned about what is going on in terms of ICU capacity in California and across the country, for that matter.
Yeah. Dr. Bhadelia, let's talk about these new strains. We've heard about them in South Africa, in Nigeria, in the United Kingdom. I've just seen Japan now saying that they've seen a new strain. How do we think about these things? Because given the panicked state that we are in about this, we're thinking, oh, my God, this thing is replicated. It's become something else. We're not going to be able to solve it. What does it actually mean that there are new strains?
Yeah, Ali, the biggest thing to understand is that the viruses in general evolve. You know, with every transmission, they evolve slightly. And the more uncontrolled outbreak you have, the greater the ability for viruses to mutate. Now, not all mutations are worrisome. The concern that we have are those mutations that affect the virus's ability to transmit or potentially change the way it causes disease. We don't have the latter part of that is not the concern. From what we've seen of the 2 strains that have been talked about the most, the strain that was discovered in the UK and South Africa, the concern is that there's greater transmissibility. Here's what you can do. The best way to actually reduce both the mutations is actually it's reducing the total number of cases. The blunt instruments that we use, such as masks, such as distancing, are what can make us keep those cases down and keep the virus from mutating. The other is it's really raised the importance of having surveillance for picking up these kinds of mutations. We have about 1/10 the capacity here in the United States that the UK does in really doing this deep genetic analysis, what we call phylogenetic analysis of the viruses. And so we, the US, need to start picking up those strains within our population, and we're behind on that account.
Dr. Campbell, one of the things that we've been talking about is the degree to which there are certain communities worried about a vaccine, including the Black community. And there's been active efforts in the last several weeks, including showing the people who were involved in the development of the vaccine, the people of color who were involved in it, showing Black people and Black nurses and Black doctors either administering or receiving the vaccine. Do you think that the publicity that it is getting is going to help bring up the numbers of African Americans who are prepared to accept this vaccine? Because they've got valid reasons historically for fearing things that the government says are okay to put in their arm.
Well, Ali, I think you're absolutely on target with that comment, because the issue is this: in the African American community, there's a lot of doubt about vaccines, a lot of mistrust, a lot of worry that they were experimenting on you. But the reality is that we need to step up. And, I took the vaccine now 4 days ago. I posted a picture and a video because I think it's important to make sure that Black professionals are actually engaged in this. This is a safe vaccine, right? And we need to vaccinate somewhere north of 80% of the population so we can get past that. I agree with what was said about making sure that the masking, the distancing, the hand washing, that's our big instrument before we can get people vaccinated. But, I have to say that other than a little bit of soreness in the arm, which I had, right? There was really no issues related to the vaccine. And I had a busy week and during the holiday week, but I was just happy to do that because we have to step up and we have to sort of say safe for the Black community to take this vaccine to make sure that you protect yourself against this virus. Because as was just stated, I mean, there are mutations are happening, but the vaccine is active against the virus as far as we know right now.
And Dr. Bhadelia, you also got the vaccine, I believe, and similar. You felt generally okay. You had exactly the same reaction that you would expect to get.
That's right. About 8 days ago at this point, and aside from the soreness in my arm a little bit, which disappeared the next day, I'm well and in good health. The other thing I just want to stress on what Dr. Campbell said is that, yes, that's exactly right. We're not with this variant. There aren't enough mutations, and we don't expect enough mutations to accumulate on the virus for the vaccines that we currently have available to not be effective. So the other big instrument in our hands to reduce these mutations is for us to get vaccinated as soon as possible, and ensuring all the kinks that are in the system and trying to get these vaccines out are resolved so we can get to a point where most of us get this vaccine.
Thank you to both of you for joining me this morning. You both are great, and I'm glad that you shared your experiences about getting it, because I think there are people who are just nervous about these things. It is a new vaccine, so to see your examples and have you share that information is really remarkably helpful. Dr. Nahid Bhadelia is the director of the Special Pathogens Unit at Boston Medical Center. Dr. Andre Campbell is the attending trauma surgeon at Zuckerberg San Francisco General Hospital and Trauma Center. Thanks to both of you.